The goal of this video lecture is to review the subtypes of major depressive disorder. So subtypes are included in the DSM as ways of describing different sets of symptoms of major depressive disorder that tend to co-occur. So because the symptoms of major depressive disorder include such a wide range of symptoms, and because so many combinations of symptoms are possible for an individual to meet diagnostic criteria, the subtypes are ways of characterizing sets of common symptoms that tend to co-occur. We're going to review 8 different subtypes of major depressive disorder that are recognized in the DSM. Some of these subtypes are characterized by sets of common symptoms that tend to co-occur. Some of them are characterized by similarities of symptoms shared with other disorders in the DSM, and other subtypes are characterized by characteristic timing of onset of depressive symptoms. So the first set of subtypes that we'll talk about are subtypes of major depressive disorder that are characterized by sets of symptoms that tend to co-occur. The first of these subtypes is what's called melancholic depression. And melancholic depression's primary characteristic is an inability to experience pleasure and what's described by patients as a distinct depressed mood. So they report that when they're experiencing a depressive episode, that the quality of their depressed mood, their subjective experience of sadness, feels qualitatively different than their sad or depressed mood when they're not experiencing a depressive episode. So they feel unable to experience pleasure, they have distinct depressed mood, they tend to experience what's called diurnal variation, so their mood varies over the course of the day. Typically, it'll be worse in the morning, and they may experience some improvement in mood symptoms later in the day or in the evening. In terms of sleep dysregulation, the melancholic subtype is characterized by terminal insomnia, so that early morning awakening. Also characterized by psychomotor abnormalities, either retardation or agitation. Changes to appetite and weight tend to involve a loss of appetite and weight loss, and also characterized by prominent excessive guilt. So this set of symptoms, when it co-occurs, we can characterize as melancholic depression. We also have a set of symptoms that co-occur that we can call atypical depression. So atypical depression's primary characteristics include mood reactivity. So an individual may experience depressed mood most of the time, but when they experience positive events, they are able to experience pleasure from those events. So they do have a more reactive mood than you might see, for example, with the melancholic subtype. It also tends to be characterized by weight gain and increased appetite. Hypersomnia, so excessive sleeping, either sleeping a lot at night or may also include excessive napping during the day. And also subjective feelings of heaviness or slowness. So when these symptoms co-occur, we can characterize the depressive episode as an atypical depressive episode. When an individual's depressive episode includes prominent abnormal motor behaviors, we can characterize it as a depressive episode with catatonic features. So remember, when we discussed psychotic disorders, we characterized catatonia as behaviors that are not responsive to the environment. So when an individual's depressive symptoms are also characterized by behaviors that don't relate to the environment. For example, this might include mutism, so not speaking, abnormal motor behaviors such as posturing, agitation, or behaviorally mimicking other people's speech or movements. These unusual catatonic behaviors would lead to a diagnosis of major depression with catatonic features. Our next set of subtypes includes symptoms that are related to other sets of disorders, where a diagnosis of a major depressive disorder is our most appropriate diagnosis, but where we also want to note the symptoms that are consistent with other diagnoses. So the first of these is major depressive disorder with mixed features. So what this refers to is an individual who's experiencing an episode of major depression, who's also having at least 3 symptoms of mania or hypomania, but they do not meet full criteria for an episode of mania or hypomania. So they may be experiencing symptoms like inflated self-esteem or grandiosity, a decreased need for sleep, or racing thoughts. These symptoms are not severe enough to meet criteria for a full manic or hypomanic episode, and they're co-occurring with depressive symptoms. So that's what mixed means. It means that simultaneously an individual is experiencing symptoms of both depression and that we might consider consistent with one of the bipolar disorder diagnoses. So in this case, we think that an individual is meeting full criteria for a major depressive episode. So we think that that diagnosis is most appropriate, but we do want to acknowledge the presence of these symptoms of mania or hypomania because that might influence our treatment decisions about what kind of treatment might be most appropriate for that individual. So a diagnosis of depression with mixed features indicates that we have some shared symptoms with the bipolar disorders. A diagnosis of major depression with anxious distress indicates that we have symptoms of major depression, but we also have prominent symptoms that are consistent with our anxiety disorders. So these might be experiences such as panic attacks or uncontrollable worry, where an individual is meeting criteria for a major depressive episode, but they're also experiencing prominent symptoms of anxiety, and we want to acknowledge those symptoms even though our primary diagnosis is a major depressive episode. Our last set in this group is a major depressive episode with psychotic features. So this is when an individual who is having a major depressive episode is experiencing psychotic symptoms, so delusions or hallucinations, that are related to their depressive episode. So these might include delusions like believing that they're evil or believing that they've been cursed. They might experience hallucinations, so they might see devils or they might hear the FBI wiretapping them. And an important thing that distinguishes major depressive disorder with psychotic features from our other diagnoses has to do with the timing of the presence of these psychotic symptoms. So remember that when we talked about schizoaffective disorder, we said that one important diagnostic criteria for schizoaffective disorder was that an individual needed to have at least a 2-week period of time where they had psychotic symptoms without mood symptoms. So major depressive disorder with psychotic features is an appropriate diagnosis when the only time that an individual experiences symptoms of psychosis is when they're also actively experiencing an episode of major depression. Another potential clue that an individual having delusions or hallucinations might be most appropriately diagnosed with a mood disorder with psychotic features is whether their psychotic symptoms are what's called mood congruent. So if the delusions and hallucinations that a person is experiencing are consistent with their depression, so for example, if they are feeling low self-esteem and feeling very guilty and having delusional beliefs that they are cursed or having hallucinations related to feeling persecuted or being evil, those are mood congruent psychotic symptoms. Mood incongruent psychotic symptoms are more unusual with major depressive disorder. So when we're trying to distinguish major depression with psychotic features from other diagnoses such as schizoaffective disorders, the things that we want to pay attention to are the timing of the psychotic features. So do we see psychotic symptoms in the absence of mood symptoms? In which case we might consider a diagnosis of a psychotic disorder such as schizoaffective disorder. And another clue would be whether the symptoms are mood congruent or not. So if the symptoms are mood congruent, that might suggest to us that a diagnosis of a major depressive disorder with psychotic features would best characterize the individual's symptoms. Our last subtypes of depressive disorders are characterized by timing of the depressive symptoms. So one is major depressive disorder with peripartum onset. So peripartum encompasses pregnancy and the first 4 weeks following the birth of a child. So if an individual is exhibiting symptoms of major depression and meets diagnostic criteria, and the onset of their symptoms occurred during pregnancy or within 4 weeks after the birth of a child, we could characterize the disorder as major depressive disorder with peripartum onset. And then our last subtype is also characterized by the timing of depressive symptoms. And in this case, it's relative to a seasonal pattern. So this type is called major depressive disorder with a seasonal pattern. It's also sometimes called seasonal affective disorder, or you might have seen it abbreviated as SAD. So seasonal affective disorder is characterized by a seasonal pattern where an individual has the onset of major depressive episodes during a particular time of year, and then complete remission of major depressive disorder during other times of year. It's very characteristic for the onset of the depressive episodes to consistently occur at the beginning of the winter months, with symptom remission beginning in the spring and symptoms remitting through the summer months. So if an individual exhibits a seasonal pattern of depressive symptoms for at least a 2-year period of time, they could be given a diagnosis of major depressive disorder with a seasonal pattern. So again, these subtypes are all subtypes of major depressive disorder, so they are ways of describing clusters of symptoms that characterize a major depressive disorder that can help us understand more about the symptoms that an individual person is experiencing.